The Academy for Integrating Behavioral Health in Primary Care, sponsored by the Agency for Healthcare Research and Quality, is an important tool for those of us interested in changing healthcare. By better integrating behavioral health and primary care, we begin to connect the disparate notions that have existed in healthcare for decades. We begin to change the way that healthcare is delivered that's more beneficial for the patient, the family, the community, that can help decrease cost, and that can improve overall patient quality and satisfaction within healthcare. Despite having 20 years of research supporting the inseparability of behavioral health and primary care, what we have are well-meaning but disconnected attempts to move our efforts forward together. The Academy helps solve some of this problem. It gives us one location, one place that we can all come together. We can look at the resources that are out there. We can find out what the current literature is, what's happening in the news as it relates to the integration of behavioral health and primary care, and what are some of the areas that we really need to focus on to advance this within healthcare policy. The National Integration Academy Council, or the NIAC, are a group of experts in the field of integrated behavioral health and primary care that come together with the common goal of changing healthcare. Their goal is to be able to focus on how the Academy can be used as a resource to help provide information to the field on what works for integration, what does the literature say about supporting the integration of behavioral health and primary care, what are some ways that we can begin to look into healthcare policy and figure out what's working and what's not working. The Academy aims to create a community. This online virtual community will be a place where people can come together and share stories about what's working and what's not working for integrating behavioral health and primary care. One of the things that we know about integration is that it's hard. This is not easy. Changing practice takes time, and it requires us to have a community that we can surround ourselves with to discuss these really complicated issues. What we hope to have here in the future is a place where the community can come and share these stories, can talk about these ideas, can share resources. Consistent with that idea of changing practice, we also have a comprehensive, up-to-date literature repository. If you want to know the state of the art, state of the field of integration, we have the evidence to support that. Hopefully practices will be able to come to this location and they'll be able to use the literature that we have to advance healthcare within their communities.